Well, today we mark 2 years since the coronavirus was first confirmed in the U.S. in Western Washington. On January 20th, 2020, a man walked into Providence Medical Center in Everett with flu-like symptoms. The very next day, he became the country's first confirmed case of COVID-19. 2 years later and 68 million cases later, the virus has now claimed the life of nearly 860,000 Americans. And now with the Omicron surge, hospitals here in Oregon are again sounding a warning.
COVID hospitalizations in Oregon move past 1,000 and could reach an all-time high this weekend or early next week. Pat Dooris reports.
2 years after the first patient in America diagnosed with COVID, the battle continues in hospitals everywhere. At St. Charles in Bend, 63 patients are hospitalized because of the virus. A third of those are fully vaccinated. They're breakthrough cases. Only 4 COVID patients there are in the ICU. The system can handle 30 patients of all types. Of those 4, none are vaccinated. As the Omicron surge continues, leaders worry about patients and hospital staff.
So we do what we can do. Our staff, our nurses, our EVS workers, our docs are just really overwhelmed. And we're all very anxious about what's ahead of us over the next month.
Becky Hultberg, leader of the Oregon Association of Hospitals and Health Systems, warned the public to be aware.
The next couple of weeks are going to be really tough, and it is important for people to understand that. There is a war going on in our hospitals against this virus that isn't visible to the public.
She pointed to graphics. This one showed the number of hospitalized people statewide with COVID. The high point was September 1st with 1,230. Today, the number topped 1,000. It grew by more than 70 people from yesterday and will likely pass the previous record soon. The boarding graphic shows the number of people statewide being kept in an emergency room because there's no place for them in the hospital, but they're still too sick to go home. The number today is just 4 below the most recent high. And 587 people statewide are waiting to be sent to short or long-term care facilities. They've recovered enough that they don't need to be in the hospital, but there are no openings at the facilities, which keeps the hospitals more full than they need to be.
It is past time to address this problem. Hospitals have been sounding alarm bells for the entire pandemic about the challenges of discharging patients. And we need help in moving patients out of the hospital to free up beds for people in the community who need them.
The state is bringing in outside people to help staff long-term care facilities and opening up temporary places for people to recover. But Holt said it's not enough.
And Pat Dooris is joining us live now. And Pat, that breakthrough number at St. Charles is pretty surprising. So is it that high everywhere?
Yeah, that really got my attention too, and I checked the numbers, and yes, it probably is. The state put out a report last week that showed 26.4% of all the COVID cases in the state for that week were breakthroughs, so that's the people that are fully vaccinated and then still get COVID. So don't let your guard down just because you're vaccinated. This Omicron is kind of a different thing, but also don't use that as an excuse not to get vaccinated, because those who are breakthrough cases are not getting as sick as the people who are not vaccinated.
Right, yep. And we've also heard about the crisis standards of care, and that's when hospitals really have to take a hard look at how to prioritize who gets medical care. It's not fun to think about that, but are the hospital leaders still worried about that?
Well, I think they are, but my sense from Becky Hultberg, the person you heard in the story there, is that they don't think it's going to happen. At least they certainly hope that it doesn't happen during this surge. You know, just making that life and death decision, who gets a ventilator and who doesn't, that'll be awful. Hopefully it'll never happen. But I checked the numbers on that as well. Right now, of that more than 1,000 people that are in the hospital because they have a confirmed or suspected case of COVID, only 68, I mean, I say only, but that's a big number if you're one of those or you're part of that family, but 68 are on ventilators now, and there's 845 available ventilators in the state. So we're not even close to having a problem with that yet, thankfully. Back to you.
Pat, thank you so much. And if you'd like more details about all of those numbers Pat just mentioned in his story, you can text the word coronavirus right to the number on your screen. It's 503-226-5088. We will send you a link with the most up-to-date information on COVID in Oregon, including interactive graphs spanning the entire pandemic and where you can get a COVID shot.